Welcome to the Dr. Melissa Show. So today we're going to be talking about mercury fillings. My practice is called Honey Dental. We're a little bit more holistic minded because we are very aware of how dental materials can affect not only your mouth but your whole body. And so when we look at how we select dental materials and how we handle them, we're very careful about making sure that we are protected, our patients are protected from any negative effects that these materials may have on them. So for example, we do not choose materials that have a higher chance of hypersensitivity to patients or negative immune reactions or allergies, things like that. So one of the topics that is very important to me is these mercury fillings that we're focusing on today. And the reason I call them mercury fillings is because 50%, which half of the mercury fillings are actually mercury. The composition is mercury. And so that to me is a very alarming fact about these materials, which kind of became something that I became aware of in dental school. So third year of dental school, I started learning about dental materials. And when I found out about this fact, I was kind of questioning why this material is still available in modern dentistry. It's something that, I prefer not to have to deal with, but if it's something that we deal with on our daily basis, for example, in my practice, even though we don't place it in people's mouths, we still are experiencing it because we have to take it out. A lot of patients still have this material in their mouth because it's the preferred material about, a couple decades ago. And what's happening with the teeth underneath is that the silver fillings, it's kind of like a piece of rock. And when you chew on it over thousands and thousands of cycles, it causes micro leakage of the teeth. Sometimes it turns into fractures that allows bacteria to get in and get underneath the filling and start having more damage on the tooth themselves. So usually patients will present with teeth that are broken or teeth that are hurting because now the nerve is affected. So we had to learn how to handle this properly because when we take out the silver filling, that's actually when the patient may be exposed to it more than usual because of all the debris with the drill going on the filling. It can send particulates and aerosol with mercury just everywhere. So a lot of my mentors are holistic minded, and I join a lot of holistic groups that help to educate me on how to handle this properly. So in my practice, my patients, if I have to take it out, they're wrapped from head to toe. They don't get anything their hair or their body because I don't want them to get any mercury vapor on themselves and go home and hug a loved one and then someone else would breathe it off of them. I also don't allow the material to get into their mouth, so I cover it. So inside the mouth is covered, and they also don't breathe that air, so they have alternative air. So I try my best to make sure the patient's protected. Also, me and my assistant inside the room, we also don't breathe that air, and we cover ourselves from head to toe so we don't carry it home as well. So I have invited some guests on the show to discuss their experience with mercury fillings. So I'm going to kind of, before we start, I want to give a little bit of history of this product and why it's still existing. So amalgam fillings were kind of discovered by, mixing mercury with coin shavings back in the day because people were trying to make gold, and they realized they can make this silver product that's actually very durable and started becoming useful in dentistry as one of the applications. It was also used in other things like furniture, clothing, and things like that. So for the past 150, 200 years, this product has been existing, and for the past 70 years, it really hasn't changed composition. So the composition's been pretty much the same back in the early 1900s. So the reason that it's practical still in today's dentistry is because of mainly low cost. And also it is known for its strength and durability. But again, what I said earlier about, the tooth is impacted long term by it. The tooth is not as strong as mercury filling. So eventually the tooth is what gets hurt in the long run. So because of this low cost of this product, it's still existing today. But my concern with it is how it's impacting the health of my patients. And so back in 1843, the American Society of Dental Surgeons, which is ASDS, was founded in New York City. They deemed that amalgam is malpractice because they were afraid that mercury poisoning in the patients and dentists, everybody involved, were a concern. And so they forced everybody to sign this pledge to abstain from using mercury fillings. However, it was something that people did not want to give up, so people left the society instead. So that society dissolved very quickly, and because of loss of membership. So this is 1843 is when a group of dentists tried to make a difference and say no to this product. And now we're already in 2018. So this is, we're almost 100 years away from when they realized this is a problem. One of the biggest evidence that this is an issue is mercury in other industries. So, for instance, back in the day, when they were using mercury in their clothing and their, for example, hats and furniture, they realized that the factory workers that were exposed to mercury vapor were starting to have a lot of neurological symptoms, and it's called the Mad Hatter disease. So, Alice in Wonderland is something that's written by Lewis Carroll. And he knew someone that had that Mad Hatter disease, and it kind of inspired the character Mad Hatter. And so that's kind of better known to everybody what's going on with that disease. It's just someone who's had experienced mercury poisoning, and they have kind of odd neurological symptoms. For example, irritability, depression. They might react differently. They might have delirium. Their behavior changes. They may have personality changes. And so this is something that's already a realistic concern. But not a lot of research have really proven that mercury is for sure a negative product. And I think and it's kind of difficult to know why. In 2015, there was a study that was published that kind of said mercury released from dental amalgams in hypersensitive people and pregnant women were a concern. But I feel that is a concern in pretty much anybody. Obviously, pregnant women, because mercury can pass through the placenta, it can damage a fetus a lot more severely than an adult. And that's kind of why, going back to why I'm passionate about this, I became pregnant third year of dental school. And so I realized, it's not just about me anymore. I have to make decisions for my children. And because I'm a mom now, I have to decide whether or not I'm willing to expose myself to products that can harm my unborn baby. And that's what made me very passionate about making sure that I practice in a way that's safe for my patients. So how do you guys feel about, your experience back in the day when there wasn't any kind of safety for you when you were having those fillings done?
Well, I had one not too long ago removed. This was before I met you. And they just literally chipped it out of my tooth, and it went into my mouth, and I know that I swallowed some of it. And it wasn't long after that I developed autoimmune disease. So my feeling is that at least contributed. So I think it's very, very important to do it the proper way.
How did you feel with, having it removed safely compared to, do you feel like afterwards you were not really affected, just kind of like a normal dental visit? Like it's not.
Oh yeah, I didn't notice any negative symptoms. And also, as a side note, again, I don't know what's coincidental and what's not, but after I had it removed recently safely, my autoimmune titers went down to normal. So I don't know how much that had to do with it, but I believe that it does have something to do with it.
So that's very interesting, because if patients have this in their mouths, one of the things about mercury is that it is liquid at room temperature, but liquid has an equilibrium phase with gases. So that means at room temperature, it can become a gaseous kind of form. So when they did studies on patients, they realized that chewing habits and your oral habits, such as grinding, brushing your teeth, chewing gum, they all contribute to the release of vapors, giving you the kind of a metallic taste in your mouth. And under certain lighting, you can actually see the mercury vapors coming off of these fillings. The problem with having these vapors in your mouth is that, you're breathing it and you're inhaling it. And when you allow the mercury particulates to get into your lungs, there's about 80% absorption into your body. And at that point, it can get into your blood and it goes through all of your organs, mainly your brain, kidneys, lungs, liver, your GI tract. They're all going to start accumulating that mercury. And so once the mercury gets into any organ, it stays much longer. So it's not like the half-life of mercury is a certain limited time, but when it's actually introduced into a cell, then it can stay for decades. And that's the problem with mercury, because when mercury is in a non-ionized form, it can pass through lipid layers of your membranes throughout your body. And the membranes are there to protect your organs and everything from invasion. But once that mercury is introduced, it damages not only the attachment of the membrane, such as your hemidesmosomes and your gap junctions. It can stay in your brain. It passes through the placenta, it gets into the baby. And so these are things that are concerning to me. There were some studies done. So, for example, they did a study, a 7-year longitudinal study on children with silver fillings. And they realized that, the children that were chewing gum and had the silver fillings had elevated mercury in their urine compared to other children. And they were trying to tie it to, academic performance and kind of other things. That's kind of hard to prove because they're correlation studies. Also, in adults, like the dentist, for example, like myself, on average, dentists have 4 times the level of mercury in their urine compared to other professionals of the same age and education. So this is something that, people are noticing, especially in older dentists. They're starting to notice that they have symptoms of mercury poisoning, such as arthritis, dry skin, headaches, metallic taste, sleep disturbances, just kind of forgetfulness, things like that. So these are all concerns with what happens during occupational exposure of mercury, because, for a dentist like myself and my assistants, we get exposed to it more than a patient would because we see it on a daily basis. So I feel it's important, to make sure that the dental operatory is equipped safely with these features to protect everybody involved with this procedure. They don't recommend, so some older dental practices may have carpet inside the practice. The problem with the carpet is that it can also absorb any kind of mercury vapor or particulates over time. And it's not recommended if you're handling mercury to have that in the practice, because that can absorb and it's very, very difficult to get out. And if you try to use a vacuum cleaner, it can actually send that vapor, it can disperse it even further. Do anybody else have opinions about, the safetiness of how you feel in a dental office that does care about how safe it is for mercury removal?
I read an article a while back that there's a large majority of dental offices that are basically contaminated and probably wouldn't pass an OSHA audit because of the mercury contamination in them. Because most of them don't have any kind of protection in place to absorb the materials, that are in the air. And most people don't know anything about that because no one will tell them. It's not published. It's not talked about.
How do you feel about doing, having mercury handled safely in your own body, like when we handle it safely versus before? Like, how do you feel like it's easier on your immune system, and how you feel after, if you feel like it's easier on you in general?
In my own experience, when I had the fillings before he removed them, I had migraine headaches, 2 or 3 times a month. And when the majority of the fillings were gone, the migraines went away. I still have occasional headaches, but the migraines were so bad that I just had to go stop whatever I was doing and just lay down. They wouldn't go away. They'd just last for hours. And it was miraculous after the majority of the fillings were gone, and I haven't had any migraines in probably over a year. And it's a very rare occurrence at worst, but that's my own experience with them. And in your office, you're the only one I've ever seen that takes all the precautions, seems to be, that are necessary, I think, to make sure the patients are protected.
Do you have an experience?
I felt something shift in my teeth a while back, and then I started having high blood pressure and started asking around about things, and I found a doctor who said, well, once she had her root canal replaced, her high blood pressure went away. I thought, okay, well, I'm going to work on that too. I'm still getting my teeth fixed up, so it isn't quite gone yet. But then I saw a DVD on amalgam fillings and things like that. And at your office, since you show lots of pictures, I found out just how many silver fillings I had. And there are a lot in my mouth, and obviously they've probably decayed somewhat, and I've been feeling worse and worse since that incident a while back. So I am looking forward to getting it all taken care of. And when you kind of wrapped me all up and put all the ventilation things in, I thought, wow, I mean, this stuff's really dangerous according to the DVD I saw. And finally, somebody is handling it with caution, because mercury, it's a heavy metal. It builds up. I mean, you take out one, it builds. You take out another, there's more, and then there's more, and then there's more. It just goes wherever it goes and can affect whatever comes in, wherever it stops in your body. So I was thrilled to see you handle it so well like that. And yes, you're the only one I've ever seen do that. And actually, they didn't even tell me what kind of fillings I had previously. And like I said, you show in pictures what they are. So I'm thrilled. I'm getting porcelain, getting all that stuff out, and getting my teeth fixed up well.
I'm going to have to say that I was not aware of any of these issues. I feel like I'm relatively healthy for my age, and I've had fillings in my teeth. I've from a very young age, I've had cavities all my life, and my mouth is full of amalgam. And I didn't want to do anything, but my friend Tracy was telling me about these things, and he was researching, and he found Dr. Melissa, and I was taking him out there to help him and drive him back, not necessarily drive him back, but accompany him on these long journeys that we're taking. We're driving 3 hours to come to her office, and that's whenever I began to realize that there were possibly cavities underneath my fillings. And when when she did check my teeth out, and I began to have some removed, I didn't realize what condition my teeth were really in. And so I'm just, I know the amalgam was just, I had cracking and fissures in my teeth. And so I'm very happy to be on a journey of getting them replaced safely and feeling better about my teeth. And I do know that Tracy has had a lot less migraines, and I'm just very happy to have healthier teeth now.
Mm-hmm.
And the way that you do it, I feel comfortable in the way that you're taking all these precautions, and I feel like you're on the cutting edge, because I know every time I come, I see a new gadget or something in the office that helps to diagnose all these issues, and so.
Yeah, I appreciate that, because there's so many technology available now that can avoid unnecessary chemicals. For example, like you were saying, I do show pictures. I don't use impression materials because it's not very accurate, and all that goop in people's mouth and makes them gag. I prefer just to scan it with 3D, and it's just more accurate, and it's safer for the patient, so you're not gagging and you're not exposed to unnecessary chemicals that you don't really need. So I'm really excited about, things that I know that I can help with the patients as well. I was talking about earlier about the fact that mercury is liquid at room temperature. When it becomes that vapor, the half-life is technically supposed to be about 20 to 90 days. But when it gets into the brain, mercury's half-life is more than 17 years. And so this can all be found on PubMed, which is a collection of research that's been done, that's been scientifically proven. The problem with that gaseous phase of it is that, like what I said earlier, it does get absorbed 80% into the lungs. And by then, they've done a lot of studies. It's hard to do studies on humans and have a very, very specific control group versus non-control group, because it's unethical to do certain things in a certain way. So a lot of the studies they've done are correlation. So they'll look at this group of people, they have mercury fillings, what are their symptoms, things like that. But that's also hard to prove that's, it could be because they drink milk. It could be, it could be a number of things. You can tie a lot of things with this. So the research that's been done on this, it's hard to prove. One of the more convincing evidence I've seen is when they do it on autopsies on people that have passed away. So individuals with amalgam in their bodies when they check the mercury in their tissues, they found 2 to 12 times more mercury in their body tissues because of their silver fillings. And they realized that, on the neuron cells in your brain, because of that long half-life that I talked about, it can last for several years or decades. The accumulation of the mercury, it can get to toxic levels. And so everybody has different threshold for what their body can handle. For example, some people may smoke for 2 years and they get, throat cancer immediately. Some people may smoke for 40 years and they don't have any problems. But it depends on how your body can kind of adapt to this material that's in your body. But mercury vapor have been shown to be 10 times more toxic than, for example, lead on human brain cells. When it does get breathed into the human body, then that's when, things start to happen. So one of the longitudinal studies I was talking about, they did a study in Germany on the kind of the elderly population, because they were kind of concerned about how the long-term impact of mercury is on people. So in Germany, amalgam was pretty popular. And so 80 to 90% of the people in Germany have had dental amalgams placed in their mouths. But when they look at people over 85, they notice that about 30 to 50 have Alzheimer's disease. And if you look at the Alzheimer's disease in general, in all of the world, from the year 2000 to 2015, Alzheimer's disease have increased 123%, whereas heart disease have dropped 11%. Heart disease is still the main killer of humans right now, but the majority so in 2050, they're expecting, so right now there's about 5.7 million people with Alzheimer's disease. In the year 2050, they expect about 14 million. So that's going to more than double. And I mean, how do you guys feel about studies like that kind of show some kind of correlation with not only the elderly population, but also with kids? Because, they've done a lot of study on kids. They, on the EPA website, they've noted that children that were exposed to mercury, because mercury does pass through the placenta, it can affect the developing fetus, causing damages to their nervous system, digestive system, and kidney damage. How do you guys feel about all of that? The research is starting to evolve and starting to come to show that there is correlation between exposure to mercury from dental materials to the rest of their health.
Well, I think it's critical to practice the safe dentistry. That was, the reason that I sought you out in the first place. But again, for me, there's enough evidence with what's trickling in, as you're saying. It's just, if there's any chance, I think it's worth doing it right, doing it safely. I had a dentist when I was a child who used to, obviously everything was amalgam then, because we're talking back in the 1960s. And he used to make jewelry. It was back kind of in the hippie days, and he would make jewelry out of amalgam and give it to all of his patients, just, for fun. And all the little kids putting on all this jewelry. And I heard that later on that he committed suicide. So you mentioned depression, and it makes me wonder, did that affect him? He worked with so much of it, not just in the practice, but then he had the hobby also of working with it. So.
And how old was he when he passed away?
I think he was pretty young, in his 30s.
Yeah. And I think that's kind of something related to when I was saying earlier, the Mad Hatter disease.
Mm-hmm.
If you have overexposure or mercury poisoning, you kind of start making decisions that's a little odd, and that can be part of it.
Right.
Do you guys have any other thing that you want to share with listeners out there that may have questions about this?
I recently lost my vision 6 years ago, and not out of 6 doctors, not one could give me a reason why. So it makes me wonder, if that has something to do with it.
When you had it removed safely, did you feel, how did it feel compared? Have you had it removed before versus the safe way?
No, I have not.
Okay.
But I also had fibromyalgia, and after the one removal I noticed a decrease in my symptoms by probably 50-60%.
And so you're kind of feeling like you're on the right track and getting it
Definitely,
taken care of.
yes.
Yeah, so so for the listeners out there that want to kind of find out more, there is kind of a DVD that is out there. It's a documentary made by someone who's very passionate about it as well, because his dad passed away from Alzheimer's, and there's no doctor that can tell him why. During the autopsy, he did note that his dad had a mouthful of amalgam fillings, and so his feeling is it could be related, but he doesn't really know. So he went on this journey to find out and kind of interview doctors, holistic group, and kind of find out what's going on with it. It's called Evidence of Harm. So if you're interested, you can look that up and watch that video. It will help you kind of get a more generalized idea of what he was able to collect with what he researched.
I would just like to add that I think that because other regular dentists don't really understand what is going on, or maybe they just don't want to tell the patient that these things. My dentist never told me that there was any possible issues. I would just, I had a mouthful, and I think that there's probably some resistance with regular dentists out there that just don't want to tackle and deal with this. And I'm really glad that you are stepping up to the plate and admitting we do have a problem and serving the public. And so I really appreciate what you've done.
Yes.
I appreciate that. And I think it's when I became a mom, I think that just changed my priorities, because I realized it's not just about me, it's about my baby. And so I guess it's like when you become a mom, you're like, you want to protect your baby in any way you can. And if I had been a dentist probably 50 years ago, and the only material I had to work with was mercury fillings, and having that knowledge in my mind that 50% of this is mercury, I cannot fathom being a dentist. I would probably walk away, just because I like to kind of wrap my career around my life and, who I am as a mom. instead of the other way around. I don't want to sacrifice my own health, my patient's health, my children's health for doing something that I feel doesn't make any sense. And so whatever I'm doing right now is, when I talk to peers or, when I had questions when I was pregnant in dental school, I think the overall blank statement is it's a safe product. But just because someone says it doesn't mean it's true when you actually look at the research and you understand how this material can impact, even your body on a cellular level, what it's doing to your mitochondria, what's doing to any kind of attachment molecules in your body. You understand that it's not meant to be inside the human body. And so, it's having knowledge like that, it's hard for me to not know it, So I have to act in a way that makes sense for my health and for those around me. So, for example, like I know coffee is a stimulant, and a lot of people drink coffee. There's Starbucks right there, and I don't drink coffee because I don't want my body to be exposed to something that I could possibly be addicted to. So in school, I just got up earlier to study. I don't feel like I need to get up and get a cup of coffee just to pass my exams, because I feel like the human will is stronger than all these possible addictions you can get involved with, such as coffee. I've never drank alcohol because it's depressant and it can affect your body negatively. I just don't like to lose control over my mind. So any kind of stimulant or depressant or any materials that I feel can compromise my ability to think clearly, I'm pretty against it. And that involves mercury. So if I'm on a daily basis drilling this stuff out, breathing in mercury vapors, I don't see that being a safe decision for myself or anybody that's involved. So that's why I'm very passionate about it, and I'm glad that I'm able to set my own practice that way and to have this safe environment. And I know about 4 dentists. One of them is also in Dallas, who is my mentor, who kind of taught me, I'm older and I've done it the wrong way before, but I've had personal health issues as a result of my exposure to mercury, and I had to change. Otherwise, I'm going to retire sooner. So that's what he told me. And, that's kind of what really inspired me, that they're willing to admit that, I didn't really know about this and I didn't really care. But now I do, because now I've had a heart attack. I've had this and that. And so that's why I'm very passionate about this. So thank you guys so much for sharing your stories with us, and hope it helps the listeners out there. Thanks so much.
You're listening to RNCN, the digital destination for premium talk radio.